Okay. Hey there, people, beautiful people. I'm gonna try to get a little closer. Okay. Hi. I'm Meg Conkling at your service. Before I get into anything, my disclosure is I wanted to make this video about my experience having my fibroids removed because I watched many other videos of women doing it, and I'm grateful for those videos because it taught me some things that I would not have thought to bring to the hospital or what to expect otherwise. So I am a little on some Percocets here and some ibuprofen. I am not a fan of drugs because I don't like the way they make me feel. I'm actually really sensitive to sound and light and lots of crowds and stuff like that, even though I love people. I am having this moment where I want to tell you just right off the bat that I am someone who believes in spiritual power and journey, and I believe in God and Goddess, and I believe that we all are destined for great things. And the reason why I'm sharing this is because this surgery was a big deal for me. It wasn't just something I was like, okay, let me just go get these things cut out of me so I can feel better. It wasn't that. It was actually a 2-year decision-making struggle on my part with really having to face that I was not coming up with the right holistic remedies and the right meditative time and the right mindset to get to the root of my problem, of whatever I have stored in my body to manifest this complication of tumors living in my body, benign tumors, which are fibroids that resulted in me becoming highly anemic and having severe heavy menstrual, which I call moon or luna cycles. I used to be in parallel to the new moon with my cycles, which, you shed the old, you bring in the new with the full moon. So I'm very into the feminine power and moon circles and women's circles and the feminine energy. And I felt like a blow to my ego when I couldn't solve my own physical issue with my uterus and my feminine sexual organs of representing my creativity. And I do believe in the chakra system and the meridians and the energy portals that live in our body that help us learn about where we're stuck and where we're blocked, so we can learn about it and heal it, so we can open that portal and experience it, personal expansion, spiritual expansion. And I'm just sharing this right off the bat because I know a lot of my friends and a lot of people on social media who I follow in these really big sisterhood groups have offered, what plants would help me and what meditations would help me. And I think just after a while, I was getting worse and worse, and everybody kept saying, no, don't get surgery, do this. And everybody had an alternative option for me, and it made me, I allowed myself to feel like shit more and more when sisters and brothers would recommend this for me because I felt like I had failed. And that was not their intention. But I felt guilt and shame around me having fibroids. So I just want to say right off the bat, if you have guilt and shame for having fibroids, for having heavy periods, for not wanting to have sex with partners because you're in pain, I want you to know you're not alone. And I'm making this, public because I don't want anyone to feel the way that I did. And this is what I'm working on now. This shame and this guilt can still live in the body even after you have something removed from you. The emotional, what I like to call the emotional constipation, is still very strong. So just putting that in the air and just, letting you know that right off the bat. I opted in to have surgery about 5 days ago. I found the right surgeon for me. I didn't trust a lot of people, nor should you. But I found someone I trusted because he had precision. And I noticed his hands were very steady. And I wanted a doctor that maybe he's not a feminine energy. Maybe he falls a little bit more on the masculine side. But I wanted a surgeon with steady hands and a practical, thinking mindset. Someone who wasn't run by emotions. And I surprised myself when I said that, when I had met him. His name is Dr. Katz. And I also love cats, and I have very strong energy with cats. Feral cats, domestic cats. And I just went by signs. About a year ago, I started losing my hair. I had a bone marrow biopsy from a doctor who wanted to make sure that I was even producing or reproducing iron, and come to confirm through his research of my results was I was no longer reproducing iron even in my bone marrow. So that raised more of a red flag for me that I was, even though I wasn't energetically or mentally getting to where I wanted to with my journey, like this expectation of where I should be in my healing journey with these fibroids, of getting rid of them through food or nutrition, or getting rid of them through meditation every day, which I've read tons of articles that women have. Unfortunately, I was considered by the medical practice of Western medicine, or Western medicine. I think the perks kicked in. That I was a minority in a majority of women. About, a big percentage of women in the U.S. have fibroids. A lot of women don't even know they have fibroids. A lot of women don't even care that they have fibroids because they're not bothered. I was very bothered. I felt a lot of pain. I haven't had sexual intercourse in a long time, since October or November, and it's now May. Due to pain, I do not insert anything inside of me because of pain. I'm fatigued. I'm lack of energy. I had to have a blood transfusion almost a month ago because my iron levels were so low. It was at number 7. Your hemoglobin, considered your iron level, your blood count, is supposed to be in the 30s. I am vegan, but I'm not even eating a balanced vegan diet, so it's not even because I'm vegan. There's so much research that vegans can can have a lot of iron. It's because they're nutritional nerds and they research everything, and they are dedicated and committed to taking care of their body on like a high conscious level. I have not been a conscious eater. I've been an emotional eater for a majority of my life. If you are an emotional eater, raise your hand. And there's nothing to be ashamed about it, but it's definitely given me a reality check that I definitely care about the planet and animals, and I also need to be conscious of what I'm doing to my body. And I was sacrificing the killing of animals for my own health, and I still am sacrificing to not kill animals at the mass rate that we are, to take care of, you know, the planet and Mother Nature and stuff. But I failed miserably as a vegan, as far as health-wise. So don't be discouraged to not be a vegan because your iron levels are low. Be discouraged to like by nothing. Just pay attention. You know, don't be discouraged, just pay attention. With that being said, I want to give you a to-do list of if you're going in for surgery or thinking about it. I will tell you right now, it is a major surgery. It's basically you having a C-section without a baby. There is a recovery time of 4 to 6 weeks. If you listen to your doctor and don't push your luck, you will not extend that recovery time. If you know, pay attention to what you need before you go into the hospital, you will have less of a torturous hospital experience, which is why I'm making this video. So a checklist that I had that I'm going to share with you to bring, and I brought it in one little, like, you know, toiletry bag. I did not bring some big overnight bag. That's so unrealistic. I brought a pillow. I brought my own water jug because I drink out of glass, not plastic. I was supposed to bring peppermint tea. I forgot it. Big mistake. Please do not be like me and forget peppermint tea. Cough drops. If you have glasses, bring them. What else did I bring? Oh, I brought healing oils, like oils to help me breathe. So eucalyptus, tea tree oil, lavender oil to calm me down for any anxiety or if I couldn't breathe that well. So I brought that. I also brought healing crystals. I brought stuff that I really believe in, like, you know, if someone gave you something and you know that you wear it on you or use it when like a big change is going to happen, you need some extra strength, and that strength is like your material item of God, bring it. And I brought my own socks and a change of clothes for when I left the hospital, and slip-on shoes. I wish I brought my own food, but they don't have a refrigerator in the hospital in my room. So I probably would have brought some apples, and I think I would have probably have had like a local, like research of a local place that would deliver me salads. And light food. The hospital food was very hard for them to believe I was vegan. They didn't put up a stink, but they were like, "You don't eat eggs?" And I'm just like, oh my God, here we go. Now that I'm recovering, I am on a high protein diet again. Like I'm forcing myself to be conscious of protein right now. And I'm also forcing myself to take accountability that this is a serious healing recovery, and I have to eat more food than my body wants right now. Even though I'm on pain meds, like, you have to eat and you have to drink a lot of water. You have to drink a lot of water. So fast forward after the surgery, it goes by really fast. You know, you wake up. I woke up, I felt a lot of pain instantly. I mean, I was like crying. But they have to move you into the bed that you're going to be staying in from the surgery bed. Just let them just be a dead fish, you know, just be super heavy. I definitely got transferred into the bed, and my parents were there. I'm so blessed. Oh my God, I was so blessed my parents were there, and they gave me pain meds right away. Thank you, God and Goddess. And basically, to make a long story short, I had 12 fibroids removed. I did ask the doctor to take a photo of them for me so I could see them, because I really wanted to see them. I've had a very intimate relationship with them for about 4 years. And I also asked them if I could take them home. Don't judge me. I asked because I wanted to plant them into the earth and plant a tree or something significant, like a weeping willow tree above them for healing. I do believe in some shamanic rituals, Native American rituals, with allowing part of the organs of the body to be healed by Mother Nature, or to cremate them in a spiritual way, transform them into a new energy. And he said I couldn't, because they do test them for cancer and they cut them up in tiny pieces. And also too, it's like a biohazard to do that, apparently. You do feel pain. Sorry, just going through a little bit right now. Most of the pain is gas, which I recommend you bring the peppermint tea. The gas doesn't just get stuck in your stomach. Oh no. Gas gets stuck in your back, it gets stuck in your neck, it gets stuck in your shoulder. You have gas like stuck everywhere in here. You're just like, ow. So the eucalyptus oil I put all over my chest here, and I was breathing in big. They also want you to breathe really big because they don't want you to get bronchitis. So they have like this little breathing machine. I was neglected by one of my nurses. I did complain about her. I will share that if you are not feeling taken care of and feeling like your nurse is really showing up and giving you all she's got, get a new nurse. I'm dead serious. Do not even settle for that bullshit, because just because you didn't have a kid doesn't mean you are less important than the women who are on the birthing floor who just gave birth to babies. There are some women on that floor who are walking around and feeling way better than you are, who just had kids. So with that being said, if the nurse gives you less attention, get rid of her. Get someone else. First time urinating is going to be interesting, I will tell you. Sorry, I'm just really trying to adjust myself right now. You are going to have to use a lot of leg power, and you are going to make really weird faces when you're concentrating on moving your body in a whole new way. You are going to be using a lot of upper body strength. If you don't have any, well, you're going to be really inspired to build it when you recover and probably start working out in a whole different way. And what else? I hope I'm not forgetting anything. Oh, before they found out that I had 12 fibroids, they only thought I had 5. So I did have the type of surgery where like they cut you open like a C-section. I mentioned that earlier, but I just don't remember the medical name for it. Don't judge me. They do give you like a Velcro wrap like thing. I call it like a bustier. It does perk up my breasts a little bit. But it's really to like hold all the organs and everything inside. You do get constipated. I'm sorry to relay that news to you. I did not hear any other videos talking about constipation. So I'm going to be real. You get constipated. It sucks. It feels like you have a charcoal stuck in your ass. Drink a lot of water. Get plant-based laxatives. They work better than the other toxic shit that's going to be sitting in your body for longer. I got this fiber powder called Unifier or something like that. Or is that the name of a festival? Oh my God. I'm having a moment. Yeah, like I said, I think the Percocet set in. What else? Oh, I drank a lot of broth at the hospital. I barely ate their food because the Percocets, because they make you constipated, you want to drink as many liquids as possible. And all they want to give you at the hospital is carbs. And not all the carbs are going to help you. Carbs don't help me. Dairy doesn't help me. So just drink a ton of water. Also to be a little prepared when you get home that you can't do diddly squat. You can't do your laundry. You can't pick anything up. You are going to need medical, like you're going to need someone to cater on you. You're going to need a mommy. If your spouse is working a full day and only helping you when he gets home or she gets home, then you're going to want one of your friends to help you, someone who will seriously request a day off of work to be with you. And at least for the first 5 days, at least for the first week, I am feeling a lot of inflammation. I am swollen. I am feeling like moody. I am feeling a lot of emotions come up because I'm sitting still. Because this is a time to heal, and those emotions are going to come up. Don't try to suppress them, whatever comes up for you. I understand maybe that's not something that is ideal to hear. I think a fly got into my apartment. I know it's not what you want to hear on a YouTube video or before you have a surgery, you know, but you know what? At the end of the day, we're human and we have emotions. So I don't know what to tell you. Hello. Clean house. Clean your house before you get surgery. Trust me. Yeah. Have some stuff in the fridge already. I bought a bunch of lemons. Citrus helps re-help tissue. Don't eat broccoli or Brussels sprouts or cauliflower. It makes you extremely gassy. Gas sucks. It's your worst enemy. Like I said, drink lots of water. If you need to, get prune juice. Loosen it up. What else? Yeah, peeing is going to feel weird for a little while. It's not that it hurts as long as you breathe and, pee like a little bit at a time. At first, for the first few days, you don't really feel like your Kegel muscles that are like it's like your perineal muscles. It's what basically you can flex and tighten inside of your vagina. You don't really feel that. There's no like activation in that area. Don't be scared to try it out. Those muscles are going to get stronger. And what else? The drive home, before I forget, was awful. I was not given pain medication before I left the hospital. Do not expect the nurse to remember that. Please make it your responsibility to get pain medication before you leave for the drive home, even if it's a 15-minute drive. Bumps never felt so bumpy. until you have that first drive home. So trust me. Yeah, I'm going to make another video as I heal, but I just wanted to share that. I hope it helps out with anything that you've been curious about. If you're considering getting the surgery, find the right doctor, do the research on what food not to eat during your healing, what foods to eat during your healing. Also do some research on some really great guided meditations that'll help you sleep in the hospital, because for me, if you're sensitive and you are more on the holistic side, or you just want to be healthier in general, just know right off the bat, like, you are going to feel slightly delusional. I know I did on the Percocets. I mean, the nurse that abandoned me, she basically like drugged me up, and I did have an option to say, no, I don't want 2 Percocets, just give me 1. But I opted in for 2 because I didn't know. I was not thinking. It's a very easy time to take